I saw that it wasn't tested on humans yet. Is that true, or is that fake news?
I think that's fake news.
You think that's fake news?
Yeah.
I'm Jeremy Lafredo for Rebel News in New York City. New York and the United States in general just made available the new updated COVID booster.
Americans 12 and older should be able to start getting updated booster shots for COVID within days.
Millions of Americans are now eligible to receive an updated COVID booster. The latest vaccines from Moderna and Pfizer are expected to be available at pharmacies and clinics around the country starting as early as today. Today.
I'm looking forward to getting the updated BA.5 variant vaccine.
But this updated booster is different from other COVID shots and boosters. Yes, it supposedly has different strains or variants than previous COVID shots, but what really sets it apart is the way in which it was tested, or for that matter, the way it was not tested. The quote, updated booster, as the talking heads are calling it, has not been tested on any humans. The current updated booster that's available at every CVS and Walgreens in the country has not been tested on any people. Only 8 mice. Normally, a novel vaccine is tested on tens of thousands of real human beings who knowingly take part in a trial, and sometimes it takes an entire decade to tweak and prove the vaccine's safety. But with the COVID emergency, consent has been manufactured to all but skip testing entirely. These vaccines are being approved under Emergency Use Authorization, or EUA. While the mainstream media historically has always found a way to ignore the lack of safety data or the negative safety signals of the COVID vaccine, the fact that these updated boosters haven't been tested on any humans yet is a fact that they are addressing.
There's also been some discussion about this new updated COVID booster, the bivalent booster, having only been tested in mice.
Has not been studied in humans. Should that give anyone pause?
It's not something that I am concerned about.
But of course, even though they are addressing it, well-paid talking heads are explaining that the fact the shot hasn't been tested on humans is totally fine. It's just like the flu shot, they argue.
The best way to think about this updated COVID booster is the same way we think about our influenza vaccine or our flu shot every single year.
I think the most important thing to understand is that they are very safe. Kind of like we update the flu shot every year.
Because we get flu shots every year that go through minimal safety testing, this entirely novel COVID vaccine should expect to get the same treatment. But even experts who sit on the FDA safety panel fiercely oppose the emergency authorization of this updated shot, and they explain that comparing its approval to the flu shot is not a fair or a safe comparison. Dr. Paul Offit, a vaccine expert at the Children's Hospital of Philadelphia and an FDA committee member, explained that the FDA's policy on influenza shots is based on decades of experience, with strain changes where the flu vaccines behave generally the same way. On the other hand, the US is still on its first iteration of the COVID vaccine, and the mRNA technology has only been in widespread use since late 2020. The agency is making huge assumptions in its consideration of the new COVID boosters. He also said that, quote, I'm uncomfortable that we would move forward, that we would give millions or tens of millions of doses to people based only on mouse data. With the entire mainstream media and the FDA in agreement on the objective fact that the updated booster wasn't tested on any humans.
So when you have a updated vaccine that serves as a boost, as it were, and it's directed against the dominant circulating strain that's in society, you have every reason to believe that that is going to be better than having a vaccine that isn't highly specific to the circulating strain. It hasn't been proven in a clinical trial because we don't have time to do a clinical trial, because we need to get the vaccine out now because we have such a situation throughout the world, and certainly in the United States. We are moving towards a cadence that for most people likely will be requiring a yearly annual updating of a vaccine in order to account for what will be the inevitable waning of immunity.
I thought for sure that the large pharmacies actually administering the shots to Americans would be forthcoming with that information. So I went to a corporate chain pharmacy in New York City as if I were trying to get the updated booster. To my surprise, I was told the fact that these vaccines weren't tested on humans, information available to the layman on every mainstream media website, is probably fake news.
I saw that it wasn't tested on humans yet. Is that true, or is that fake news?
I think that's fake news.
You think that's fake news?
Yeah. It has to have a small population before it can be marketed to people.
So it was tested on humans?
Huh?
So it was tested on humans?
Yeah. I mean, they have to go through testing through animals first and then on humans.
But the humans, they already did probably.
Yeah.
These blatantly false messages from the pharmacy, which is the middleman between the vaccine and society, serves those who wish to vaccinate everyone by discounted well-informed fears as false conspiracy theory or fake news. During her interview with MSNBC, CDC Director Rochelle Walensky conceded that it's one thing to make the vaccines available and another to get the shots into people's arms. To accomplish the latter, the CDC is working with, quote, trusted messengers.
It's one thing to get these new boosters out there. It's another thing to get people to actually put them in their arms. Does your agency need a new game plan to get more people to get shots in the arms?
Yeah, so we're doing a lot of that hard work right now. That work is allowing trusted messengers to continue to send our message. We are simplifying our message. The message is you need to get your fall booster vaccine. So go ahead and get it.
For Rebel News in New York City, I'm Jeremy Lafreda. If you don't think the corrupt WHO should be exercising its power over supposedly sovereign nations, go to nopandemicctreaty.com and sign our petition. That's No Pandemic Treaty.